My name is Falguni Patel. I'm a board-certified gynecologist and cosmetic surgeon and the founder of Rejuvenate Center for Medical Aesthetics and Wellness. I created my practice in 2011 mainly because I wanted to educate my patient and treat them as a whole so that they can be empowered and relive their life to their fullest potential. As a gynecologist, I've had the privilege of taking care of patients in all facets of their lives, from prepubescent kids to the postmenopausal women. During this journey, I myself had my first obstacle. I actually went through severe postpartum depression after the birth of my first child. I found myself making many unhealthy choices in life and in my diet. My road to recovery was slow, but I was successful because of my knowledge and how my body worked and what hormonal imbalances and deficiencies were present. I was also able to succeed because of the emotional support I received from my friends and family. I applied my knowledge to healing myself, and this is how my center was created. My desire to empower my patients is through education, knowledge, and compassion, and making sure that their goals are met both mentally and physically. Now I have the privilege of being part of so many lives in such an intimate setting, and at the end of the day, I am humbled by the trust given to me. So besides being a board-certified OBGYN in this subspecialty in aesthetic medicine, I'm one of the few surgeons throughout the United States that has a niche in gynecological plastic surgery. So because of my eye for aesthetic needs, as well as my gynecological expertise, I feel that it is one of the few places that patients can actually come to and get the service and the treatment that they need. The most requested invasive procedure in my practice is labiaplasties and vaginal rejuvenation, aka vaginoplasties. Those were the two biggest, followed by body contouring with the BodyTite device. I've been performing OBGYN procedures now for a little over 20 years, and I've been performing the aesthetic gynecological plastic surgery cases for over 15 years at this point. In my office, we are a full-service Medi-Spa. So when it comes to non-invasive procedures, there's a lot that I perform. I would say the most common is, of course, Botox and fillers. Facial rejuvenation is done in many ways, and part of it is doing, obviously, injectables, but also teaching my patients about good skincare. So skincare is not just skin line or skincare products, but we're also talking about good nutrition. So we have IV infusion treatments as well, which helps balance the nutrients and the vitamins in a patient, which also allows for the natural beauty of a patient to come through.
The most commonly asked questions that we receive is who does the procedures and what background does the staff have? So all of our staff on the Wellness Center are medically trained. In our med spa, we have an esthetician and we also have skincare specialists. Everybody is properly trained and certified in all facials and skincare products that we have. As far as injectables and all energy-based lasers and also surgical, Dr. Patel does every treatment.
When I started my practice a few years ago, it was predominantly women. Now I actually treat men as well to balance their hormones and to empower them just like I empower my female patients. As the first couple of male patients started a few years ago, I realized that they are no different than women. They have their insecurities. Many of them come to me for hormonal replacement. I actually do a thorough workup, more of an integrative style workup, and based on their needs, I replenish them with vitamins, minerals, and hormones as needed. And they also come in for aesthetic needs, such as injectables, as well as treatments such as just facials. This is the one place where you're not judged. Come in and talk to me. You can tell me if you're having difficulty with sex. You can tell me if you don't like sex. You are normal. It is part of aging, and I'm here to help you.